Brad, we got a great video coming up. People are going to want to watch this one.
Okay.
It's about something that's about 7 or 8 millimeters in size, and it can kill you.
Like a spider?
No, it's not. It's not about spider bites. 7 or 8 millimeters.
A bullet?
Not a bullet. The video is not about gunshot wounds.
Mosquito?
It's not a mosquito. Think of it. 7 or 8 millimeters. It's inside you. It can kill you.
Appendix?
Appendix. Appendix. Is it a ticking time bomb or just a nuisance in your belly?
Or is it a ploy by general surgery to hog the OR?
That's right. Maybe they just made up the appendix. It doesn't even exist. You're going to have to watch this next video to find out.
Here we go.
Welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Mooney.
And we have a guest.
That's me, Dr. Nicole Callan.
Thank you so much, Dr. Callan, for taking time out of your super busy day and
Thank
life
you for having me again.
Be with us. You might remember Dr. Nicole Callan. She did some talks with us. We discussed anal fissures. We discussed hemorrhoids. Gave us the lowdown on those topics.
Hopefully everybody is stocking up on their fiber and all brand buds.
All right. What are we talking about today?
Today we were planning to talk about appendicitis.
Excellent. Okay, so
I love the appendix.
All right. Well, let's start with what is the appendix?
So the appendix is a little appendage that comes off your large intestine. I'll show you my model here. This is the appendix here. It's a little outpouching that develops when you're developing as a baby. We don't really know the function of the appendix, actually. We think it does secrete some mucus and perhaps some immune cells early on in life, but there's no known function to it.
So later
So you
in
don't
life,
need it.
it's kind of useless, like wisdom teeth.
I suppose wisdom teeth could be helpful if you don't have enough of your other molars, but
Tailbone.
Yes. We've kind of evolved just to require a table of contents, no longer the appendix.
So basically, it's about as useful as nipples on a man.
I suppose.
Okay. So why do people have issues with their appendix then?
Well, there's three most common causes to get appendicitis. The first would be, your most common is like a little ball of stool, or I like to call it poo, that gets stuck right at the opening of the appendix. And so because the appendix secretes mucus and fluid, therefore if you plug it up with a little ball of poo, then your appendix starts to get big like a balloon and it gets inflamed.
So that's what appendicitis is. It just means inflammation of the appendix.
Correct, yeah.
Okay.
That was number one. You said there was three.
Oh, right. Number two is the lymphatic cells that actually are in the appendix can get swollen for reasons we don't know. Viral, who knows? And so they can actually get puffy, swollen, block the appendix, and then the mucus doesn't empty, the appendix then starts to fill up like a balloon, giving you symptoms. Third cause would be tumors. And then there's other weird and wonderful causes, but we'll stick to the primary.
Okay, so the appendix itself gets obstructed, the lymphatic system gets obstructed, or a tumor's present.
Yeah.
The top three causes?
Yeah.
Okay.
So how are people presenting? So I'm at home and I'm like, I got pain where?
Yeah, so initially, our bodies are kind of neat. Initially, when your appendix, before it actually gets full out inflamed and ballooned out, you might just have pain that's centered around your belly button, kind of in a band-like fashion. Now, the presentation can be different, but this will be your typical presentation. So usually pain around your belly button, and eventually, as the inflammation persists, when this starts to get big and inflamed, the pain then migrates to the right lower side of your abdomen, and that's where you're getting actual acute inflammation once it's tender in that spot.
Okay, so generalized pain first, and then as it progresses.
Generalized, but around the belly button.
Okay, around the belly button pain first, and then as it progresses, it starts to localize to the right lower side.
Yeah.
Okay, so make sure you're watching this video before you have appendicitis. Watch this whole video, you're gonna get a lot of useful information, because if you're having that pain right now, we should get it checked out. But by the end of this video, hopefully you'll be a little smarter about appendicitis and be able to look at the whole thing through. But really, if you're having a lot of pain and you're worried now, get it checked out.
Some people will get fevers.
Yep.
Nausea. The nausea usually comes with this umbilical type, the belly button pain, and vomiting, of course, is not uncommon as well.
So these people are sick and they're sore. Does this happen quickly, like over minutes or hours?
It
or
varies.
days, or?
So some people it could be over days, and some
Okay.
people it could be very quick. So I think if being somewhat smart about seeking care if you're suspicious of it is appropriate, and earlier intervention is always better.
Okay.
Okay, so you mean if you're feeling this pain and you're worried you might have appendicitis, you should go to the hospital or go to your doctor and get it checked out.
Yeah. Get an ultrasound, and usually they'll start with an ultrasound, some blood work.
Okay, sure. Let's talk about that diagnosis. So someone comes
Physical
in,
exam, which is so important.
right? Someone comes in with their abdominal pain either around the belly button or already localized to the right lower side, and they go see the doctor. Could be in a walk-in clinic or in an emergency room type setting. What's going to happen? How's the diagnosis going to be made?
So yeah, they'll start with your physical exam, which will be examining your abdomen, seeing if you have the pain here. If you're really early, you might not actually present with that pain down here, but your ultrasound should still show some findings.
So an ultrasound will be ordered to check it out, and that'll show what?
A big appendix. So a normal appendix will normally be less than 7 millimeters in size.
7 millimeters.
Now there are variations in this, but and generally, there are features on ultrasound we look for to suggest inflammation. So bigger than 7 millimeters, a thickened wall to it. Compressibility, so your appendix is kind of like a little worm, you should be able to squish it, but when it's inflamed you can't actually squish it.
Okay.
There'll be fat that will be inflamed around your appendix.
Okay, so those are findings they can see on an ultrasound. And then is the diagnosis made with ultrasound, or is there any other tests you have to order?
So if you can see the appendix on ultrasound and make a diagnosis combined with your exam, your blood work and your ultrasound, then that's good. If you can't, sometimes people will get a CAT scan to verify that. Mainly the older age population, it's also helpful to have a CAT scan to make sure you're not missing some other reasons that are more sinister for the appendicitis.
Okay, so what would that be?
Tumors.
Tumors, okay. So you want to make sure there's not a tumor in there.
Yeah.
And it's the appendix. Both of which are serious problems, but the tumor, of course, carries with it.
Just a
worse
different
than
surgery, so.
All right.
So now you have your diagnosis. What's the time frame on doing it? What are our treatment options?
Yeah, so generally when you have appendicitis, the best thing is early intervention.
Okay.
The earlier you do surgery, the better. Generally when you admit people, you'll book them to the operating room right away, and they usually get done, I would say within 2 to 8 hours, as quickly as we can do. Not because of impending death, but just because you have an inflammatory process and you want to remove it. People, however, can still die of appendicitis, and it does happen, so. It's rare, but it does happen.
Well, I'm sure people will be interested in that. So how does that happen? How do you end up dying from appendicitis?
So generally, I would say that this is because of appendixes that perforate and rupture. And so you can imagine there's a column of stool in this, and that will leak out through this perforation through the hole. And so the more it spreads through your abdomen, the sicker you will get.
Okay. So, while it doesn't happen often, it's possible to actually die from appendicitis.
Yeah, you can.
And that's why
I think nowadays it's unlikely, but it's still possible.
Okay, so that's why it's so important to get this checked out.
Absolutely.
Quickly. All right.
Does anyone get treated with antibiotics? Does anyone say, I don't want surgery? I say, you know what, I want kind of growing attached to my appendix. I'd really like to keep it, unlike most people.
Yeah, so you can treat people with antibiotics, and there are a lot of studies out there that would support it. So we usually will give people the option of removing their appendix versus taking antibiotics. Your risk of a recurrence with the antibiotics is a bit higher.
Sure.
Obviously, because you still have an appendix.
Right. Okay.
Okay. So let's say you're coming in, and whenever patients come in, we always have a differential diagnosis. It means this is what we think it is, but it could be these other things. What are some other things that can mimic or be included on the differential diagnosis for appendicitis?
So the most common will be this, especially in the younger population, kids, will be this mesenteric adenitis, which is a viral infection.
Okay.
It very much will mimic appendicitis. You have to think always about people who could have early presentation of Crohn's, ulcerative colitis, inflammatory bowel disease. Obviously, you're always thinking about tumors. It could just be a gastro as well, right? So some people can just have a gastroenteritis.
So just inflammation
Yeah.
in the gut. Okay, so let's say you've come in, you've been assessed, a history and physical examination has been done, the investigations like an ultrasound or a CT scan have been done, you have appendicitis, it's come to surgery. How do you do the surgery? What kind of surgery is it?
Yeah, so it's a nice little surgery actually.
Yeah.
It's called laparoscopic appendectomy. They used to do it with an open incision, lower abdomen. Now it's 3 little holes, one at your belly button, one just above your pelvic bones here, and then one in the left side. And basically we just go in, find the appendix, put a little lasso at the base of the appendix where
Welcome
it meets
to
with
Paul
the
and
colon.
Brad's 3D House of Colons.
It's high tech. It's really.
It's high tech.
And then cut it, put it in a bag, take it out through your belly button.
Awesome. Okay, and that's it. So then you have your.
It takes generally about 45 minutes, but it
Okay.
can take longer, can be faster. Just
Okay.
depends on the appendix.
Yeah.
So I've had the surgery. Am I going home the same day? Am I going home the next
Some
day?
people can go home the same day, some people, so it depends, ideally you want to have your pain well controlled, you want to be able to hydrate, and not be vomiting, and then you can go home.
Okay.
So that can vary. And depending on if you've had a perforation, then you might stay longer in hospital.
All right. So let's say all goes well. My recovery period. Like how long is recovery? When can I go back to work?
Yeah, so that would vary, but generally about 2 weeks,
Okay.
Does that depend on how much you like your job?
mostly.
That's what I find.
Anywhere from 2 weeks to 6 months.
That being said, I tell people to be cautious with lifting. If they do a lot of heavy lifting, I just don't want them to get hernias at the belly button.
Same for sports? Like 4 to 6 weeks kind of thing?
Yeah,
for sports?
generally.
Okay.
Yeah.
All right. So basically, we've got this pain around the belly button that eventually localizes to the right lower side. It could be from an obstruction of the appendix, the lymph system, or a tumor around the area. Most common 3 causes. Could be some other things going on, but your doc's going to rule that out with an ultrasound, maybe a CT scan,
Some blood work.
some blood work. What do you look for in blood work?
Just elevation in the white blood cells that suggest infection.
So white cell elevation to suggest infection. Then you're going to opt for treatment. Treatment's going to be either antibiotics, which is it more commonly surgery or more commonly
More
antibiotics?
commonly surgery.
Okay, so more commonly you're going to have surgery, and that's a laparoscopic appendectomy through
Yeah.
the scope. It's going to take you about 2 weeks to recover.
Yeah.
Depending on how much you like your job, you'll be back in 2 weeks to
Yeah.
3 years. And
3 years.
anything else?
Still kidding me.
Anything else? Is that everything about the appendix?
I think that's about it.
All right.
Well, that's an awesome summary. A lot of really great information. So if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.
Hey, before you swipe away, thank you so much for watching our
Yeah,
videos.
for sure.
We know they can drag on, get a little bit long and boring sometimes, but it's all information that we're trying to pass along.
And so if you want to watch some of the other videos, swipe it up here,
Where?
up here.
Okay. Let me do it for you.
And remember to subscribe down below.
Let me do that for you.